Welcome back. This is Good Morning Kenya, and we are glad that you have stayed with us. In case you're just joining us, we are now getting into yet another segment right here on the show, and I am joined by Dr. Mary Nyamongo. And Dr. Mary Nyamongo is the Executive Director, African Institute for Health and Development, and she's here to just talk to us about matters health and development and how far they have gone as an institution to just ensure that all this is in check. Welcome to the show.
Thank you very much, Vivian.
We're glad to have you on here.
Yes.
Now, if I may just begin by you telling us what exactly the African Institute for Health and Development was established, and why was there a need for us to have such an institute?
So the African Institute for Health and Development was established in 2004 and was registered as an NGO by the NGO Board of Kenya. We established it, four of us, myself, Dr. Lynette Okengo, Professor Kaendi Munguti, and Professor Isaac Nyamongo. I was the vision behind the African Institute for Health and Development. We call it the AIHD, but sometimes it's difficult for people to connect, but it's African Institute for Health and Development. And essentially to generate evidence for health programming and policy. I've worked for KEMRI before, AMREF, African Population and Health Research Center, but I realized the need to have a locally led institution that really focuses on what affects people, on communities, and on working at the three levels where you generate evidence through research, but that evidence is then used to implement programs that are meaningful, that are impactful at the community level, and also policy formulation and implementation. And so we started activities in 2004. This year, we were celebrating 20 years of work. Our work has covered many areas in the health sector and in the development sector also. So we work on neglected tropical diseases, non-communicable diseases. We've done work on HIV and AIDS. We've worked on gender and GBV, gender-based violence. We've also done quite a bit of work on social protection, working with the Ministry of Labor and Social Protection. Basically, the main agenda is to empower communities for dignity. A lot of the diseases we look at, especially neglected tropical diseases, are diseases that affect mainly the poor and the vulnerable. And so working through the communities, with the communities, our main vision is to empower them, to use their resources, to work with them so that we can ensure this dignity and this better life for communities. Yes.
So you've touched on your key areas and the most important things that you work on, or that is, and non-communicable disease is one of them, and you've mentioned the neglected tropical diseases. It's actually a new area because I've really not looked into the neglected tropical diseases. When you talk about first the non-communicable diseases in the country, just how serious of a challenge is it for us in Kenya?
Yeah, so examples of non-communicable diseases, we have diabetes, we have cancers, we have cardiovascular diseases, hypertension, asthma, sickle cell, kidney diseases, and so various numbers, statistics have come up, especially in Kenya. We're still working on ensuring that we have good statistics on each of the diseases, but a range of around 40% of hospital admissions are due to non-communicable diseases. And I'm sure every one of us either knows somebody who has cancer, is involved in fundraising for a cancer patient. And in the past 5 years, we've just seen a real increase in the various cancers that are in this country. In terms of diabetes, again, we've seen an increase in the report of diabetes, and mainly because there are more opportunities now for screening. So we see quite a bit of activity around diabetes. I'm also currently the national chair for the National NCD Alliance for Kenya. And our work mainly is around advocacy. We work with the associations and of people living with NCDs. And therefore, we are beginning to expand also just beyond the non-NCDs. We have teams looking at dementia, renal patients. The vice chair for the alliance is John Kikonyo, who is a renal patient survivor. So we have a lot of NCDs now that people are beginning to look at rheumatic heart disease. And therefore, as a country, I think we really do need to pay more attention to NCDs. We work very closely as an alliance. As you know, we are an NGO. Work very closely with the Minister of Health through Dr. Gladwell Gadesha in ensuring that we increase not only understanding and knowledge, but also we increase access to treatment. We expand services from the main town centers, therefore, so that people really don't have to travel to Nairobi to get a diagnosis, that counties and regional facilities are able to provide some of these services. But most importantly, I think we really want to focus on communities, because by the time you get a diagnosis, it's too late. We are very focused on prevention, promotion, and that if we can prevent diabetes, if we can prevent hypertension through nutrition, through lifestyle changes, we can actually save a lot of families from the devastating effects of NCDs. And so promotion is health promotion and prevention are key strategies of what we do. But we also recognize that people need treatment. So how do we ensure we do screening? How do we ensure that people get to facilities that can offer the services that are necessary for people with NCDs? And then we have a team that's looking at palliative care. So what do you do when you're actually unwell? How do we support you? How do we support your families? So with the NCD Alliance, we're looking at continuum of care for everybody in this country. But the truth, the sad truth is that when you get a diagnosis of cancer, it really doesn't matter how much wealth you have. You spiral. You spiral economically. It's expensive. It is emotionally draining. And therefore, the need for us to really critically think about how do we support patients with NCDs, patients with cancer. The other key issue we are beginning to tackle as an alliance is on mental health. And I think in the last 5 years, 4 years, we've got a lot of attention now being drawn to mental health. And there are cases more so now where we are recognizing that depression is actually a disease. We all say, oh, leo niko na stress sana. And we talk about it like it's normal, but it's a sign of a disease. Bipolar, we're beginning to see quite a bit of diagnosis on bipolar. We also have just mental health problems that continue to go without due diagnosis. And also there's still a lot of stigma. We see a lot of isolation. We've had a lot of suicides in the past 10 or so years. And so as a country, we are beginning to ask ourselves, what do we do to ensure that we pay adequate attention to mental health? The government has a task force in place. The government has strengthened and enhanced the services around mental health, but we need to do more. There's still a lot of gaps in mental health. We are now in the process of decriminalizing suicide, and therefore that in itself is a key step towards addressing mental health issues. But there's still a big gap.
There's still a lot to be done.
There's a lot to be done, especially in the NCD space and on the mental health
Actually,
platform.
I want to take you back to the NCDs. That's the non-communicable diseases. I mean, research shows that, 7 out of 10 people die from NCDs all over the world. So it's really something that needs to be looked into. So probably as a country, do you feel like we're doing enough in terms of management of non-communicable diseases, and also in terms of the support that we give to the patients of these diseases?
As I said, Vivian, if a family member is diagnosed with cancer or a mental illness, it's very few families that can afford the care. A friend whose daughter died early this year, she had a mental illness, indicated that any time she took her to care, she would spend between 500,000 and 1 million shillings, unless you don't, unless you really have a resource base that can sustain it. It's impossible. A lot of families are struggling with cancer patients. I know facilities such as Kenyatta National Hospital really offer good services, but still it's draining, financially draining for a lot of families. And all of us are social capital for our homes, our communities, our families. All of us, at some point, you are raising funds for one illness or another, or a death. So it is draining. Out-of-pocket payments for NCDs are draining, and it's expensive. So as a country, in as much as we say finances are not infinite, it's important for us to ask, even with the new social health insurance, what we can do for NCDs. Yes.
You mentioned concerning the neglected tropical diseases. Probably someone is wondering, what are some of these diseases? And when you call them neglected, does it mean that they are not being looked into really? Or tell me more about the neglected tropical diseases.
So the WHO has acknowledged 21 neglected tropical diseases globally. And Kenya is endemic to 17 of them.
Okay.
Neglected tropical diseases are a range of diseases that are endemic in tropics and subtropics areas. In Kenya, I think we are familiar with bilharzia. In Kiswahili, we call it kichocho. We also have soil-transmitted ehrlichiasis, which is intestinal worms, minyo, in short, in Kiswahili. We also have lymphatic filariasis, which we call elephantiasis, mainly endemic on the coastal region of Kenya. We have onchocerciasis, although onchocerciasis is also called river blindness. Kenya is suspected to have eliminated it through vector activities in the 1950s. It was mainly endemic in the western belt, in Kakamega, Vihiga, Kodera forest area, and some places in Kisii. We are now in the process of trying to ascertain that we no longer have transmission. We have leishmaniasis. We have other diseases, new entrants, known as mycetoma, which is basically skin NTDs. Chikungunya, which we heard about. Chikungunya was reported some time ago in the country. And so the range of 21, we as a country have been verified by the World Health Organization of having eliminated guinea worm. So as a country, we are endemic. The reason they are called neglected tropical diseases, they affect mainly the poor and the vulnerable. And they are also a result of poverty, and they cause poverty. And so if you look at schistosomiasis, it's endemic in areas that people don't have access to clean water and poor sanitation. And so if you go, we are currently working in Homa Bay, Siaya, Busia, Kisumu, and Migori, also Kakamega, Bungoma, Trans Nzoia, and Vihiga, and the whole of the coastal counties, the 6 coastal counties. And it affects people who don't have access to proper and adequate sanitation. And so if you solve the problem of water and access to sanitation, we also work on trachoma. Trachoma is also a water disease. And therefore, a lot of people who are exposed to these diseases are people who cannot afford proper sanitation, who cannot afford latrines. We still have 15 of our counties with open defecation. So these are 15 counties. These are diseases that can be solved through proper nutrition, proper sanitation, and proper access to clean and safe water for domestic use. Yeah.
I hear you on that. Now, maybe what does the institution do, or rather, what role has the institution played or is playing in ensuring or informing health policies?
So on the 2 fronts, because health policy is informed by evidence, and we do hope increasingly as a country we'll use evidence to inform policies. So let's go first to what we are doing in terms of reaching out. Because if you look at our country, we have fantastic health policies, really good health policies.
Are we implementing them?
Our Kenya health policy is completely superb. Our universal coverage pronouncements are, if we implemented them, we will not have the same problems we are having. And we have policies for, we have specific guidelines even for the diseases we are talking about, for cancer, for diabetes. We have a lot of frameworks and policies. Fantastic. We fall short on implementation. And therefore, as an institution, we basically do need to work towards how do we then roll out these policies. For NTDs, we just launched our 3rd national NTD master plan, 2023 to 2027. And the master plan is geared towards ensuring that we eliminate 5 of the NTDs that have been earmarked for elimination. And this is bilharzia, intestinal worms, lymphatic filariasis. We're actually on track to eliminating that. Trachoma, we still have a few areas that still need treatment. And then onchocerciasis, as I said, was eliminated many years ago, 1950s. So we just want to confirm that it was eliminated. So our main focus in as far as we look at what policies need to be put in place, we are cognizant of the fact that we have a lot of good policies. How do we support the government to implement? How do we work in partnership with the other public entities and the private sector to implement these policies? How do we make a difference to the communities that are still carrying the burden of these diseases? So that's where we are currently, and we can talk about that in specifics.
Yeah. And how do health policies influence, development goals, from the local level to the national level, if well implemented? So policy making in this country comes in at a different point. And if you are really to develop policies that make a difference, we would go by bottom-up approach, where communities come in and talk about what their issues are, and then we structure that up and put it high on the political agenda. But through our members of parliament, through our senators, we are seeing a lot being done. For instance, the current issue on tobacco control, alcohol control, suicide prevention. And so those efforts really galvanize our approach to health in this country. At the community level, I think
what is lacking. And again, I'll go back to say the government has done quite a lot, especially with the community health promoters at the community level who are very close to the people who need these services. But I think we'll go back to the issue of how do we implement policies? Because if you look at our policies, they are geared towards ensuring that Kenyans live in dignity. But the SDGs are still geared towards ensuring people live healthy lives, all the SDGs combined. But how do we effectively do that? That continues to be the challenge, Vivian. Yeah.
All right. As we come to a conclusion of this conversation, your main vision, you know, as an institution or as an institute, is ensuring that all Kenyans and Africans at large live in dignity.
Yes.
How far are we to getting to a point where truly people are living with dignity?
I think we are still far. I think we are still far, especially the last population census indicated around 39% of us still live below the poverty line. Another 15% maybe, I don't know what range, are still, if you get a chronic disease, you drop into the poverty. So we are still far. And unless also we really sort out our water, sanitation and health, we improve the living conditions of our communities. NTDs will continue to be a problem unless we really ensure people have access to screening, have access to treatment, and those services are readily available. We'll still have NCDs continue to be a major problem. We are not in any way saying malaria, TB, HIV are less important. We are saying it's important to focus on these other conditions that are also affecting our communities.
Yeah.
Yes.
All right. Thank you so much, Dr. Mary, for joining us and shedding light on this matter that we have gotten to talk about. We appreciate that you came to the show.
Can I share a bit, a photo of our strategy?
All right, very
Strategic
quickly.
plan 2024-2029 will be guiding the activities we do in our institution.
All right, and you just launched it by
We just launched it
yeah.
Last week.
Okay.
Thank you.
Thank you so much. This is where we get to end Good Morning Kenya for today. Thank you so much to each and every one of you who has been tuned in. We do this again tomorrow, same time and place, God willing. My name is Vivian Dagwa. Enjoy the rest of your viewing. Goodbye.